Oh, sorry. All right.
Okay. Um, so yeah, all right. So going back, so I'm the health officer for
Mhm.
Washtenaw County, director of the Washtenaw County Health Department. We also have a board of health, which is an advisory board that works very closely with the health department. And the um, the board of health members are appointed by county commissioners and include two county commissioners that act as liaisons to the Board of Commissioners. And so Commissioner Hodge probably already explained that he
Oh,
sits in that role on
mhm,
our Board of Health. So he's a commissioner, a county commissioner, but
mhm.
he's also a liaison. And along with Commissioner Katie Scott, the two of them sit on our Board of Health as commissioners. Now, we had different members at the time when we made the declaration of racism as a public health crisis. That was in June of 2020. We were certainly shortly after the murder of George Floyd and in the very beginnings of COVID and the COVID pandemic. Um, the health department, the Washtenaw County Health Department, has for several years before COVID really put a focus on working to address health inequities in our county.
Mhm.
But the Board of Health, the leadership of the health department felt that it was important to take this additional step of declaring racism as a public health crisis. One, to name racism, to acknowledge um, that it has and continues to harm people. Also, particularly as a health department, showing the health impacts of racism,
Mhm.
the disparate health outcomes that we see in our county, even though we have a county generally that has overall good health outcomes, we see that not everyone has equal opportunity to achieve those good health outcomes. So that I think was a really important part of it, as well as really acknowledging that in order for us to do our work in public health and to improve the health of our community, our county,
Mhm.
we need to acknowledge that racism is essential to public health and to our work in public health. So, the Board of Health passed the resolution shortly after the Board of Commissioners also passed a resolution that was a little bit more broad in scope in terms of declaring racism a public health crisis. For the Board of Health, obviously, our focus really was on public health and the impacts of racism on public health and health outcomes in our county. Um, so I think that's just kind of what I would say as far as background.
Yeah, yeah.
Do you have any questions about any of that? Did that give you enough information there on
Yeah,
terms of
yeah.
context and background?
Yeah, that did. Yeah. Mhm.
Okay, okay, great. So in terms of what that's meant for us, certainly our health department has been at the forefront of COVID response
Mhm.
for over 2 years now. And we very early on, through our epidemiology team and surveillance reporting, saw the disparate impact that COVID was having in communities of color in Washtenaw County, and particularly on the east side of the county in 48197 and 48198 zip codes. And so it became really essential to kind of, even though we're always working through an equity lens, but to really bring a laser focus to ensuring equitable distribution of resources and services during COVID. And so that meant at a time when resources were really limited, like testing initially, like vaccines when they first, became
Yeah.
available. It really meant prioritizing resources to those communities, to those geographic areas, And a lot of that was done by working in partnership with community members, community organizations, community leaders, whether they were faith leaders, other trusted messengers in the community, other important stakeholders. And so that certainly has been central to our COVID response. But in addition, we recognize that as a health department, if we really want to move towards anti-racist public health practice, we also recognize that there is internal work that needs to happen as well. And so the declaration of racism as a public health crisis was not just externally focused, but also internally focused to really address our public health workforce, training and competency for anti-racist practice, and to develop more tools that we could use internally to ensure that our health department moves towards that anti-racist practice. And one of the things that we're doing is we are currently working with a group from the University of Michigan School of Public Health to really incorporate and develop this anti-racist public health practice. First, by doing internal focus groups, really understanding for our leadership, our staff, kind of where we are in terms of anti-racist practice and understanding of anti-racist practice. Getting feedback from community members, particularly we have a group called Community Voices for Health Equity. It's a group that has existed well before COVID, but working very closely with them to bring community voice and experience to the process and to our learning and development. And then eventually through this process with the School of Public Health, looking at how to develop a tool. We're calling it I believe, a justice impact assessment, a tool that we can use to evaluate and to implement programs and services in a way that really follow anti-racist principles and practice. So that's something that we're doing and working on now, and kind of moving along. But that's, I just wanted to share that because I think it's important that the focus is not just external of the health department, but also internal in our own capacity and workforce, and also our policies, right? So, really looking at a broad view of our practice in public health.
Nice, nice, nice. That answered so many of my questions.
I'm glad.
Yeah. Um, so you spoke on working with different organizations as well.
Yeah.
Well, since the declaration, I know you said you're working with the U of M organization. What else organizations have you been working with, such as during during like the height of the pandemic? What other organizations have you been working with to go with preventative measures to counteract racism and housing and healthcare, just to counteract that?
Yeah, that's a great question. And I think, one of the things that's happened during COVID, which has been, I think, a really good thing, is that, we've always had lots of community partners that we work with as a health department, but I think the number of partners and the diversity of those partners has really expanded during this time. Plus, we have many organizations and groups that have really, responded because of the COVID pandemic to meet needs that they were seeing on the ground in the community. And so we also have some newer groups and organizations that we've been working with. But to give you some examples, so we've been working very closely with an organization called Mexiquenses in Michigan. So really helping us build, strong ties to the Latinx community. We've worked with them everything from, flu clinics to COVID testing to COVID vaccine clinics. And so they have been instrumental in not only getting information out, but really being that bridge to resources and services and acting as those trusted messengers in getting information out to the Latinx community. We also have worked with, excuse me, we also have worked with many African American faith leaders, and in particular, when we were starting to implement our vaccine efforts, that was critical. We started doing vaccine clinics at churches in partnership with these faith leaders. That was incredibly important, not only because it was about bringing the vaccines into the community, but through leaders and in places of worship that were known to the community, and people that, faith leaders that are trusted in that community. So that those became really, really important. During the most recent Omicron wave early this year, we did a lot of outreach in conjunction with various organizations, including Supreme Felons, for example. Supreme Felons helped us get KN95 masks distributed, home test kits. That was something that we didn't have available at the beginning of the pandemic, right? So now we had these, over-the-counter home test kits, and we wanted to get those into the hands of people that needed them the most, particularly in 48197, 48198. And so being able to kind of tap into those networks was really, really important. And I think, we ended up distributing just in 2 months, I think with the help of Supreme Felons and other community partners, we ended up distributing over 100,000 KN95 masks and over 25,000 home test kits.
Oh, that's pretty awesome.
Yeah.
That's
Yeah.
very cool. So moving forward, what areas do you feel you guys have to address first, or are you looking to address?
That is a great question. So Commissioner Hodge may have mentioned the funding that has come to the county through the American Rescue Plan Act. So the county is receiving a little over $70 million through the American Rescue Plan Act. It's been a lot of community engagement to identify, the most important ways to use those resources. And certainly we know that the whole sort of purpose of these funds is to address the impacts of COVID-19, not just when it comes to public health, but when it comes to financial stability and education and, various sectors, housing and so forth. So I think as we move forward, really looking at the initiatives that are happening because of these resources. For public health, we are expanding our community health workers. So we're just in the process now of, many of them just started recently. So our goal is to have a team of community health workers that will be based in various neighborhoods and areas of our county where we see greater health disparities, to not just, and this isn't COVID focused, this is broadly focused on public health, but to engage with community, identify together what are the public health priorities that we need to address, because it may not be the same for every community or every geographic area of our county. So really letting the community, through community engagement, help drive what those health priorities are that need to be addressed, and then working to build capacity, link to resources, provide services that help to address those priorities. So community health workers, we have a mobile, we have an RV now.
Yeah.
So, trying to get that out also in conjunction with the work of of community health workers. So I think that's one thing for public health that we're really excited about. And certainly a lot of that also is based on looking at our public health data too. So we want to be engaged with community, but we also want to be data driven as well, because we know that there are some specific areas where we see not only greater disparities in our county, but specific health issues that are particularly important to address, like the disparities we see in maternal mortality, for example. So anyway, that's one area. And of course, there's a lot of other things happening through other departments, other organizations and initiatives with this American Rescue Plan Act funding. But that's something that we're really excited about. And I think the other piece, because of course, a lot of it is making sure that we are providing resources and services and tackling, at least on a population level, those disparities that we see. But part of it also is working, as you just mentioned earlier, working across sectors, right? So not working just, from a public health lens, but really thinking about all of the sectors that impact those social determinants of health, like housing and access to transportation. Even, thinking about the physical environment, having safe places for exercise and safe places for youth to engage in, community activities. So all of that also is part of what we want to work on. We can't do that alone. Obviously, it requires lots of collaboration, but there also has to be some, policy level work that really looks more upstream at how we change and address the long-term historical impacts of racism on the systems that operate in our county.
So I really appreciate that. Okay, so one of my few questions left. You mentioned statistics and disparities.
Yes.
In terms of Washtenaw County, I believe statistically, people of color only make up less than 25% of the population. Was there a disparity that jumped out to you in terms of the people of color, what they have as opposed to like their white counterparts per se? Was there something that jumped out to you where you had to say, we have to address this first?
So that's a little bit of a tough question for me to answer because
My apologies.
no. Let me just explain, because so I became health officer in September of 2019, and we started dealing with COVID just a few months after that. So most of my focus, and not just mine, the health department, most of our focus has been on COVID. And so when we've, sort of prioritized, focusing on the inequities and disparities we were seeing, a lot of that was related to COVID. But I will say that one of the things that we're working on now is what we call a community health assessment. We were supposed to do it in 2020. Normally, the health department does it every 5 years.
Yeah.
We were supposed to do it in 2020, and because of COVID, it just we couldn't do it because we were responding to COVID.
Yeah.
But we are now getting back to that. And one of the things that that public health focuses on, and certainly something that we as a local health department are responsible for, is assessing the health of our population, of our community, right? Public health, we look at health from a population, community-wide standpoint. And so we're going to be starting the community health assessment process. And through that process, we get to a point where, based on the information that we gather, the feedback that we get from community and other stakeholders,
Mm-hmm.
we identify community health priorities that then we develop strategies to address. And so, that is to say, we will be focusing on kind of revisiting what those priorities are.
Mm-hmm.
From our past community health improvement program, we had priorities that focused, for example, on maternal infant health. We had priorities that focused on various chronic disease areas, as well as substance use disorders and behavioral health.
Mm-hmm.
And through this process, we'll see if those priorities remain the priorities. But for now, I think that we certainly have, just in the short term, I'll say, because of COVID, we know that a lot of our community members have gone without other prevention services. And so, for example, right now we are really working to ensure that our kids get up to date on all the other immunizations
Mm-hmm.
that are recommended for children, because our children, our young kids, our infants, they have fallen behind on their immunizations. And obviously, beyond COVID, we know that there are a lot of other vaccine preventable diseases
Mm-hmm.
that we want to make sure stay that way, right?
Yeah.
that are prevented. So that's one thing certainly that we are focusing on.
Mm-hmm.
And then of course, there are always emerging issues that come in public health, right? So now we have monkeypox.
Yeah.
So, here we are. COVID hasn't gone away. We're still, responding to COVID.
Mm-hmm.
But now we also have to mount a response to monkeypox and be prepared. Already we're doing vaccinations for monkeypox. So that's kind of the nature of public health as well, because
Yeah.
you have priorities that you can identify by looking at data, by gathering community input, engaging with stakeholders.
Mm-hmm.
And we're also responsible for responding to any other public health emerging issues or emergencies.
Yeah.
So that is the fine balance with public health, and all of that, of course, with very limited resources.
Yeah. All right. So I only have like two questions left. I'm sorry.
Okay.
Um, so my first question is in regards to monkeypox, because as we know, there was a disparity between how people of color were impacted with COVID as opposed to their white counterparts. So in regards to monkeypox, how are you guys trying to plan to make sure that we don't have a part two per se in terms of disparity?
Yeah, that's a great question. I think from the very beginning, we really focused on outreach to community organizations and community partners.
Mm-hmm.
And so that, I think, is something that we've done from the very beginning. Again, we're in a very similar situation when it comes to vaccines, that there's a very limited supply available. And so it's a balance also of reaching the population that is most impacted right now,
Mm-hmm.
which is mostly men who have sex with men, but also understanding that it's not limited to
Yeah.
a disease just among men who have sex with men, right?
Yeah.
Anybody could be exposed and contract monkeypox. And so it's also important from a communication standpoint that we not stigmatize
Mm-hmm.
the MSM or LGBTQ community,
Mm-hmm.
but that we are sharing accurate information about risk, about prevention, and of course about how to get access to testing, access to vaccines. So that's been really important. And like I said, the community partners working alongside with community partners has been really essential. And getting information out through those networks has been really important. Our our medical director just did an Instagram live session with a group called A2 Gays to address questions about monkeypox, to talk about vaccination. So really, I think, those are the kinds of outreach efforts that are really important.
Yeah, yeah, you just partially answered my next question. But I was going to ask, how, in your opinion, do you believe would be the best way to avoid this stigmatization that's happening with the LGBTQ community in terms of monkeypox? Because, as you know, when something like that starts to fly, it comes in waves,
Yeah.
especially to their community. What ways would you go say are the best ways to address it to not have them be stigmatized about this disease?
Yeah. Yeah. Again, I think communication is so important here. The
Mhm.
messaging it's challenging in some ways
Yeah.
because, of course, we want to focus. First of all, we want to focus on the behaviors that might put someone at risk, right? Rather than it being sort of part of um, a group identity or a gender or sexual identity, but really focus on what are the behaviors that can put people at risk for monkeypox.
Yeah.
And again, with the understanding that some of those behaviors may be, more prevalent in certain communities, but they're behaviors that, many
Yeah.
engage in, right?
Mhm.
Um, but also, again, um, sort of balancing that at this point now, there isn't a significant risk to the general population,
Mhm.
but at the same time, we want people to understand that anybody can be exposed to monkeypox and may
Mhm.
be at risk of contracting monkeypox. So understanding just kind of the basics about transmission, about prevention,
Mhm.
um, and I think the other thing, and I was going to say one other thing that just flew out of my head. Um, oh gosh,
No, yeah, happens to me all the time. I'm with you.
oh, I was on a roll there, and
Yeah,
then
yeah, yeah.
um, gosh, I'm sorry.
No, it's okay.
It'll
It's okay.
come back to me.
Yeah.
Um, but uh, but anyway, so yeah, and I think I think what I was going to say also is just because, for example, with vaccination,
Mhm.
because the vaccine supply is so limited, really also making sure that the vaccination is going to people who are, most at risk,
Yeah, yeah,
or most vulnerable to monkeypox.
absolutely. And my last question is a pretty simple one. Is there any other information you would like for the readers to know about how we're going to move forward, or is there anything that you would like to get out there for the article?
Um, I think I think you I think you covered it.
Yeah,
I feel like we talked about a lot of things.
yeah.
Um, I don't think I'd have anything else to add
Mhm.
that I didn't already touch upon.
All right. I am very thankful for this interview and I appreciate it very much.
Well, it was really nice to talk with you, Antonio. And when do you think this article will appear?
Um, so it's due on, hold on, I'm going to stop the recording real fast.
Oh, okay.